No, okay, fine.
It's a good day at Salisbury District Hospital. Today, it's only 20% of beds that are taken up by people who should be discharged already. People like Martin.
So at the moment, is this home?
Yes, I'm afraid so.
Martin is medically ready for discharge, but he will need care when he leaves. Care which isn't available, so here he stays.
How keen are you to get home?
Oh, very keen. Because I have family at home and they're missing me as much as I'm missing them.
At Salisbury, they believe the key to getting people back to their families is increasing mobility when patients are here and trying to move them on as soon as possible, because issues escalate rapidly.
Once you start getting into that 3, 4, 5 days of already being ready to leave the hospital, they start to deteriorate. It is impossible.
That rapidly in just a few days?
Absolutely. Because if we're not careful, what happens is you get used to sitting in the chair all day. As soon as you start to get them stuck in hospital, their needs start to become more. Usually that's the reason they're stuck.
Yeah.
And it just snowballs from that point forwards.
Those delays can get significant. Here at Salisbury, the longest delay last year to get someone medically fit out of hospital was 210 days, but can be much longer. According to Freedom of Information request provided to us by the Labour Party, the longest delay last year was almost a year, 361 days. That was at Leeds Teaching Hospitals Trust. In fact, of all of those trusts that responded to the FOI request, 62% had at least one person waiting more than 100 days, and more than a fifth had at least one person waiting more than 200 days.
Leeds Teaching Hospitals NHS Trust say they've introduced a new process of reviewing patients with the longest length of stay, which has had significant success. They've also embarked on a joint health and social care change programme. And it is the social care system, say doctors in Salisbury, where many delays are created, the results of which are felt in the hospitals.
When we look at emergency department challenges, time and time again, the root cause analysis suggests the problem sits outside of the emergency department. And we can put as much resource into every emergency department in the country as we want, but unless we address the downstream problems and the discharge problems, we're not going to fix that, and harm will still occur in emergency departments in patients waiting for ambulances.
From where you are right now, do you see a big improvement coming?
No, not at this moment in time.
Far too often, those who could leave hospital don't and end up never leaving. Last year, 5,296 patients who had been declared medically fit for discharge then died in English hospitals.
The frustrating thing for many of the hospital staff is these are people who you want to have in their own home or a nice environment, and they are now dying in a crowded 4, 5 or 6 bedded hospital bay with very limited natural light, no fresh air, etc. It's not a good environment for these people to spend their last days.
Go on, talk me through it. So who have we got in here?
Right, so we've got adult social care, we have adult community services for Wiltshire, and we've got SFT staff.
And they're all working towards getting
together.
people out the door?
Yeah, in different ways.
This hub opened just last week. The aim, ultimately, freeing up beds.
The longest delay at Salisbury was like 210 days.
Yeah.
Do you think this is actually going to make a dent in that?
Yeah, because the third part of this team is around those complex case management. So really having a look, when you've got someone who has been here for the length of time you just described, they are really complex cases. They are people who have multiple needs, multiple agencies involved. So having someone for the families, have that continuity of one person to talk to, will also help as well. So it just means that one person is holding that case, can understand where we are with that, and then move things forward if they get stuck.
The spokesman for the Department of Health and Social Care said the number of patients each day who are medically ready to be discharged but still in hospital has reduced by 1,500 in England since January, and over the next 2 years are investing £1.6 billion to speed up discharge.
Have you got any indication yet as to how soon you might be able to get home?
I get indications from people. The doctor I saw this morning said, we want to get you home if we can. And I think people are on my side. I'm always afraid that one day someone will say, sorry, you're not going out. And that would be, well, it would break my heart.
Tonight, Martin remains in hospital.
Well, no one was available from the government today, but the Shadow Health Minister, Liz Kendall, does join me now from Westminster. Good to have you back on the programme, Liz Kendall. Do you agree with this thesis that basically you cannot reform the NHS without reforming social care?
Absolutely not. The two go hand in hand. And you saw in your programme there the tragedy for Martin, that he's stuck in hospital when he doesn't need to be there, for his family who desperately want him home. And to be honest, it's a tragedy for the taxpayer too. We know that last year, £1.7 billion was spent on keeping people who don't need to be in hospital in there when they could be cared for in the community and at home. So we need real reforms and real changes to provide that care in the community and at home, to speed up the process and to join up those services. And I think the tragedy is the government has failed to have that vision for the future, that vision for reform, which is what we're putting forward today.
But real reform also demands real money, and this is not money that you, the Labour Party, are offering or putting on the table at the moment.
Well, look, last year, the government spent £750 million on their delayed discharges programme. And the sum total of fewer people who are in hospital at the end of that programme was 472. Why? Because they focused on care home beds, not care in the community and at home. They didn't join up the services in one team like you're seeing in Salisbury, and they didn't have that programme for rehabilitation to get people's muscles moving again. That money is money that should have been spent on real reform. So I think
but what are you
it's
going
not
to
just
spend?
Well, next year, the government has said they're going to spend £600 million on a delayed discharges programme. I would
and how much will you spend?
I would like to see. I'm not going to make promises that we can't keep. I know it's very frustrating for you and I'm sure your viewers, but we don't know what the state of the economy is going to be like next month, let alone by the time of the general election. But what we are saying is use existing resources more wisely. Get that community support, join up those services so people aren't battling the system, focus on preventing people from ending up in the first place. Reform, as well as those resources, is what we desperately need.
But when Keir Starmer outlined his priorities for the NHS last month, he barely even mentioned social care. And you've been talking about it for a long time, you care about it deeply. But if you care about it, surely you've got to have a plan in place and some numbers attached to that plan. And I just don't see that.
That's not my analysis of what we announced last month. We set out a big vision to shift the focus of services towards prevention and early intervention. Look, Matt, as we all live for longer, we're going to have to stay fit and well and living independently for longer. We are too focused on a hospital-based system when what people really need is support to stay living at home, which is where we all want to be. That's the big vision. Firstly, having a new principle of home first. All the incentives are designed to keep people at home. Secondly, when we announced our workforce plan for the NHS almost a year ago, we talked about the really urgent need to have more district and community nurses, the people that help you manage your long-term condition at home. And thirdly, it's really about joining up services. Look at what they're doing in Salisbury. They're actually bringing all the people together into one place, so families aren't battling around the system and waiting for people to ring each other. That vision of one team joined up around the person, so it's better for them and better for their families, is exactly what Labour is calling for.
Now, the week is likely to be dominated by celebrations of the 75th anniversary of the NHS. But what state is the NHS really in? Our health and social care editor, Victoria MacDonald, is in the newsroom now. Victoria.
Well, Matt, today the chief executive of NHS England, Amanda Pritchard, said that there are 3,000 patients a day in England's hospitals who have been there for more than 14 days. Now, some of them, of course, are there because they are acutely ill, but too many, as Paul showed in his film there, are there because they are stuck in hospital because of the lack of social care in the community. This is care that has been underfunded for decades. There is a serious shortage of staff, and the current government and Labour have failed repeatedly to adequately say how they're going to fix it. And yet you speak to any NHS or social care boss or a health economist and they will say You cannot deal with the problems being faced by the NHS if you don't start to sort out social care. And delayed discharge has a domino effect throughout a hospital, and that's when you see the ambulances queuing at the front door because there is no bed for a new patient to be admitted.
Now, none of that backdrop makes for a very happy 75th birthday for the NHS, does it?
No, well, there are so many reasons to celebrate for the NHS at 75. I mean, I've helped judge a fantastic Our NHS at 75 exhibition of photographs showing the care and the technologies and the staff, and it was very moving. And there'll be a service in Westminster Abbey on Wednesday. But there is no getting around the fact the NHS at 75 is in crisis. And that's not a word that should be used lightly, but there is a staffing crisis. Sickness rates are at record levels. There are 124,000 vacancies. And now we have heard about a long-term workforce plan, but that doesn't resolve right now. The longest waiting lists ever, 7.4 million strikes, junior doctors and consultants. And today, the Health Foundation published polling data which showed that the NHS, while a main source of pride to the British public, yet at the same time, 3 out of 4 people believe that the NHS's principle of free at the point of delivery will be eroded over the next 10 years, and half expect to pay for some services currently free at the point of use, which is not a very happy birthday message.